Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Pace of COVID-19 vaccination in Yobe State slows down amidst hesitancy and superstition. Imo State government debunks rumors of 37 COVID-19 related deaths in Mbitolu local government area. And World Health Organization confirms a global drop in new confirmed COVID-19 cases in the past week. According to vaccine manufacturer Johnson & Johnson, the second shot of its COVID vaccine administered about 2 months after the first dose increases its efficacy to 94% against moderate to severe forms of the virus. The J&J single dose only offers 70% protection. And according to J&J Chief Scientific Officer, the company has now generated evidence that a booster shot further increases protection against COVID-19. In the meantime, the Nigeria Center for Disease Control, NCDC, reported 513 new cases of COVID-19 in 19 states and the FCT. The agency, in its update for September 21st, said Lagos recorded the highest infections with 132 cases, followed by the FCT and Rivers State. It also recorded 469 persons who were discharged on Tuesday after recovering from the infection. Let's take a look at the update.
The pandemic is not over yet, and the Nigerian Center for Disease Control is advising Nigerians to take collective responsibility and practice all non-pharmaceutical interventions to prevent the spread of COVID-19. 513 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 19 states and the FCT, indicating an increase from the figures reported earlier. Lagos, the epicenter of the disease, had the highest number of infections with 132 cases, followed by the FCT with 80 cases. 70 cases were recorded in Rivers. Kaduna had 43, Edo had 40, Ondo 32, Delta 23, while 21 cases were recorded in Akwa Ibom. Kwara recorded 16 cases, Gombe had 12, 9 cases were registered in Anambra and Benue State. Kano had 7, while Oyo had 6. Other states that reported infections include Borno, Plateau, Bayelsa, Katsina, Ogun, and Jigawa states. The latest data includes 0 cases reported from Ekiti, Nasarawa, Osun, and Sokoto State, as well as a backlog of confirmed cases and discharges from Kaduna State for the 20th and 21st of September. The overall count of confirmed cases in Nigeria now stands at 202,704. 469 people have been discharged in the last 24 hours, increasing the total number of recoveries to 191,370. 3 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,664. Presently, there are more than 8,000 active cases in Nigeria, while over 2.9 million samples have been tested so far. In Africa, there are more than 8.1 million confirmed cases and over 207,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 229 million, while deaths are now more than 4.7 million.
And to Imo State, where the government has confirmed 3 fatalities as a result of complications from the deadly coronavirus between the month of June and September. Addressing journalists in Owerri, the state capital, the Commissioner for Health says the implication is that the 3rd wave of the virus is very much around, and residents of the state need to adhere strictly to the non-pharmaceutical protocols to curb the spread. He also used the opportunity to debunk rumors that about 37 people died in Mbitolu local government area of the state due to COVID-19 complications and other unknown diseases. He says the government has already put in place a task force to ensure that residents are sensitized about the deadly Delta variant.
From the investigations that the surveillance team had and the Director of Public Health, there is nothing that depicts that kind of picture that is making the rounds. And that became necessary for us to now also inform Imolites and Nigerians that there is the information is false and should be regarded as that. However, we are keeping surveillance. We are keeping surveillance in those areas, not only in those Mbiri area, also in Mbitolu and other neighboring towns, and even the states in general. The issue of the third wave, that's the Delta variant of the COVID-19, has come. And we know that the virulence of this Delta variant is something that is quite shocking. People just fall sick within 3 days they are dead. Many of them that are confirmed as COVID cases are also taken to the isolation center. For most of the periods, we have our isolation centers having about 22 to 24 people there for treatment. And we are lucky that many of them came on time and were able to treat them. But incidentally, we also lost some. We also lost some that period. But the lucky ones, especially those that came from the NYSC camp, all of them survived. And throughout this period, we've just only had about 3 deaths.
And medical practitioners in Bayelsa State are commending residents for an encouraging turnout at the various COVID-19 vaccination points in the state. Vaccinating health workers at different centers in the state say 100% of their target population were vaccinated in the first phase.
As for last week, because of the weather, the turnout was poor. And as for this week, at least we are trying, and today we are already give 7. Then as AstraZeneca we are giving 38, and Moderna is 48.
The turnout has been encouraging. It's been quite encouraging. It's unlike the first round where we're begging people to come for the vaccine. But this time around, the people are coming on their own, willingly coming on their own to accept the vaccination.
And despite the assurances of health experts on the efficacy of COVID-19 vaccines, many Nigerians, including frontline health workers and journalists, are still skeptical of taking the jab. According to investigations by our correspondent in Yobe State, most of them who are the forefront of creating awareness on the disease are yet to make up their minds on whether to accept the vaccines or not.
Since the outbreak of the COVID-19 pandemic, state governments and agencies such as the World Health Organization in Nigeria have undertaken several risk communication campaigns on the dangers of COVID-19 and the need for vaccination in some states, including vulnerable communities in Yobe State. Despite these strategies to encourage vaccine uptake, some residents in the state remain skeptical.
We supposed to be the front line of taking this vaccine, because we are the people that inform and enlighten people on this vaccine. I saw a very close relation taking this vaccine and has a reaction, which is very, very bad. So maybe I'm scared.
However, this health expert assures of the safety of the vaccines, advising all to dispel myth about the vaccines and ensure they get vaccinated.
The reason why we are being vaccinated is to prevent ourselves from getting the infection and to prevent others from transmitting the infection to them. We can take our children for immunization. Equally, we are to protect ourselves also. We are to accept with wholeheartedly. It doesn't have any adverse effect. It doesn't harm anybody, not even in the near future or even in the far. It has no any clinical scientific analysis that shows there is an effect that can come later on in the life.
A visit to some vaccination centers also indicate that the inoculation exercise is still ongoing, although at a slow pace. More awareness to ensure that people are fully informed about the importance of vaccines will contribute to an increased uptake by the population.
Joining us now for more on vaccine hesitancy is Onyebuchi Eloke. He's a public health consultant and a microbiologist. He joins us now from Abuja studios. Thank you for joining us on the program. First, what's your overall take of Nigeria's vaccination rollout so far?
Yeah, thank you very much. Thank you for your question. Hello, thank you very much.
We can hear you loud and clear. Just go ahead.
All right, all right. So my take is like Nigeria is doing well, but I would like to start this way. You know, healthcare is dependent on technicality and political. So, and the ability to manage a pandemic is dependent on these two factors. This is very, very important because if there is a gap in one aspect of this factor, then the whole process, there becomes a primary targeted gap in the process. So the technicality drives the political aspect of the campaign. Now, Nigeria has, on the 2nd March 2021, this year, Nigeria received 3.9 million doses from of this vaccine from AstraZeneca, from the COVAX, sorry. So this is very, very important. The Nigerian Minister of Health is also told us that they are discussing with Afri-Exim Bank to make this vaccine available for the local population, which is very much important. And they are also organizing the private sector to make this vaccine available. Now, but the major problem is the vaccine hesitancy. The population are not coming up to take up this vaccine. So how can the government manage this? It's very simple. They need to create what we call a vaccine case management team and a national data sharing team or database, which is very, very important, so that they can drive and understand, do a root cause analysis and understand why people are not coming up to take up this vaccine.
In some of the studies,
National Primary Healthcare have done a lot by creating what we call vaccine accountability officers at the local population, both in the state and the local government, which their duty is to see that the local government are meeting some of these criteria in these vaccine protocols, in terms of training and the collection of vaccine, disposal of the vaccine vials after inoculation. Now, the federal government are doing their best, but are the population also cooperating, helping the federal government to meet up with the federal government agenda of inoculating about 70% of the Nigerian population?
So let me jump in. Let me jump in here on the area of the inoculation you talked about, and very briefly, some have said that, and some of the studies I've read, that one of the issue of vaccine skepticism is that people's trust in government's approval of a safe and effective vaccine against COVID-19, that is really the biggest driver of vaccine uptake.
Sorry, can you come again? I didn't pick that.
Would you say that that is our case, that the reason why the vaccine hesitancy might be prevalent is that the people do not trust government's efforts so far in, sending the message about the safety and efficacy of the vaccines?
Yeah, actually, when the 1.6 million people have come up in a country of 200 million people have come up to take up the vaccine, which is about 0.9% of the population, despite the assurance of the Mr. President and the Vice President coming up to take up the vaccine to eliminate the idea of vaccine hesitancy and COVID-19 denialism, the National Primary Healthcare still need to do more, in terms of addressing the vaccine hesitancy. Actually, it's still a problem because in a country of 200 million people and 0.9% have been vaccinated, that means that we, the health workers, still have a lot of work to do, especially at the local population, at the hinterland. And so I would say that the effectiveness, the assurance of the federal government in terms of, telling the population or the citizens that this vaccine is effective is not just enough. That's what we need to find a healthcare management tool to create what we call vaccine dialogue at the local population.
This is definitely an issue that we will have to revisit. Definitely an issue we will have to revisit. We'd like to thank you. Wish we had more time to talk about this. We've been speaking to Onyebuchi Eloke, a public health consultant and microbiologist. Thank you for joining us on the program. Well, still to come, WHO reports global cases fall significantly to 3.6 million last week from 4 million the week before. Stay with us. The World Health Organization says the global commitment to provide COVID vaccines to Africa needs to translate to real delivery of the vaccines to the continent. This comes as the UN described the situation as a moral indictment, with over 90% of Africans still unvaccinated. Mr. Richard Mihigo, the WHO Africa Regional Director, said Africa had done well to distribute the few vaccines it has so far received, despite some of them arriving with a short time to their expiry dates. The WHO official also says the global COVAX vaccine scheme, which is intended to help poorer countries, had done well despite being unable to access enough vaccine supplies. The COVAX scheme has supplied about 37% of the 177 million vaccine doses supplied to Africa, with the rest acquired through bilateral deals and donations from a variety of sources. Dr. Mihigo urged countries to support the scheme by channeling their donations through COVAX. And this is as the WHO reports global cases fell significantly to 3.6 million last week from 4 million the week before. And the United States is promising to buy 500 million doses of the Pfizer-BioNTech coronavirus vaccine to donate to countries in need. President Biden is expected to announce at a virtual summit today on ending the coronavirus pandemic, amid criticism that his administration has done too little on the global stage. The Biden administration already purchased 500 million doses of the vaccine in July to be distributed in tranches to poorer countries through COVAX, the initiative led by the World Health Organization, Gavi, and the Coalition for Epidemic Preparedness Innovations. Well, this commitment by the U.S. will bring the total number of donated vaccines to the world to more than 1.1 billion. Meanwhile, on the sidelines of the UN General Assembly, the U.S. President called on global leaders to fully vaccinate 70% of the world's population by next September. Our correspondent, Maria Bird, reports on the latest CDC guidelines in the United States.
United States continue to be challenged with COVID-19 as many children are just weeks into their school year and already facing quarantine. This is why parents are hopeful that vaccine approval is only weeks away. It is expected that Pfizer will be the first emergency approved vaccine for children ages 5 to 11. While children ages 5 to 11 are the next eligible group in the U.S., many older Americans are waiting for the CDC to fully recommend booster vaccination. Due to the high rate of COVID-19 infections in the U.S., the White House COVID-19 Task Force has developed recommendations for living post-COVID.
That many people, particularly those who spend a long time in the hospital, have residual organ system dysfunction that's directly explainable by organ system damage. For example, someone who has damage to parenchymal lung tissue very often has pulmonary function abnormalities that persist due to explainable organ system damage.
America's vaccination rates are higher than most countries, but hospitalizations and death tolls continue to rise. From Washington, Maria Bird, Channel Television News.
Maria joins us now. Hello, Maria. What do we know about how safe the Pfizer vaccines are for children?
Thank you for having me. Yes, the Pfizer vaccine is said to be the most safe for children. So they're expecting it to get approval with flying colors through the FDA, and they're expecting that it will probably roll out within the next 30 to 60 days here in the U.S. And so this vaccine has been tested with various groups of children. They started as young as 18 months, but I think those trials have still not proved to have the same success rate as for the children between the ages of 5 to 11. So this is what they're expecting will be the leading vaccine for children, and potentially thereafter we will see Moderna and Johnson & Johnson come forth with some vaccine options as well.
Ryan, talking about Johnson & Johnson, they said its second dose shows that a booster shot further increases protection against COVID. So, I mean, how are booster shots ongoing there?
Yeah, so Johnson & Johnson obviously is later in the game of being able to look at how booster shots are going to impact those who've had that vaccine. They're stating that individuals that are 3 months from having a shot are obviously going to have an increased capacity to be able to withstand if they are in contact with any of the COVID-19 mutations. But they're saying those individuals who are 6 months or more removed from having their first shot would actually have a greater immunity to other forms of the COVID-19 virus. And so it is clear that they have done some clear studies on this. The question now is whether or not the CDC is going to provide clear guidelines and recommendations so that all Americans can feel comfortable and knowing when a booster shot should be taken, or if they don't need to take a booster shot this soon after having their first vaccine.
And that's also looking at the argument of the WHO and several other partners on not needing booster shots. But finally, Maria, what is the main message of the COVID-19 task force in the US this week? And this is concerning the safety protocols and the different mandates.
At this time, the White House task force for COVID-19 is really focusing on one, the importance of vaccination. They're focusing on the importance of mask wearing. I think they're a little concerned that Americans who have adopted, which I think they want Americans to adopt the idea that vaccines are the best method to protect themselves from the virus, are not going above and beyond and getting a booster shot that is not necessary, because there's still limited research on the potential other impacts of the vaccine. And so they're really wanting to be a little bit conservative on their advice in that area, and also knowing some of the other challenges that the rest of the world is facing with just needing access to vaccinations. Obviously, children are becoming a great concern because of the fact that we are seeing an increased number of children contracting the virus, and that obviously is increasing the number of children that are having to be hospitalized. And so those are some of the protocols. But furthermore, they're also wanting to bring forth the impact of the virus even long term. We heard Dr. Fauci mention the fact that after COVID and after what is considered to be recovered, oftentimes you still have organ damage. And so there are some longer term impacts of the virus that I think people have not necessarily taken into consideration. As we know, there were just thousands upon thousands, hundreds of thousands of cases here in the U.S. And obviously we've seen some unfortunate deaths as a result as well.
Our Washington correspondent, Maria Bird, live for us in the U.S. Thanks for joining us.
Thank you for having me.
And the Kenyan and British governments say they're working on a system to recognize COVID vaccine certificates issued in both countries to facilitate travel between them. They made this known in a joint statement by the British High Commission and Kenya's Health Ministry. Here's more on the global update.
The World Health Organization has confirmed global COVID-19 cases have fallen in the past week. There were 3.6 million new cases reported around the world last week, down from 4 million new infections the previous week. The drop marks the first significant fall in cases for more than 2 months. The most coronavirus cases were seen in the United States, India, Britain, Turkey, and the Philippines. The WHO also says the fastest spread in Delta variant has now been seen in 185 countries and exists in every part of the world. Health authorities in Germany are planning new rules under which unvaccinated workers would not receive compensation for lost pay if coronavirus measures force them to isolate. While the rules would affect people who test positive for the virus, they would also include those returning from trips to countries designated high risk for COVID-19, including Britain, Turkey and parts of France. France says it has no plans at this stage to ease health pass restrictions set up to rein in a fourth wave of COVID-19 infections. The French government's cabinet will review on October the 13th a draft bill allowing it to extend, if necessary, the country's COVID-19 health pass requirement beyond a November 15 deadline. The pass, in place since July, proves the holder has had the COVID-19 vaccine or has recently tested negative for COVID-19 or recovered from the illness in the last 6 months, thereby allowing the holder to enter places such as bars and restaurants and sports venues. And finally, a COVID-19 therapy derived from a llama named Fifi has shown significant potential in early trials. In a treatment made of nanobodies, small, simpler versions of antibodies which llamas and camels produce naturally in response to infection. Once the therapy has been tested in humans, scientists say it could be given as a simple nasal spray to treat and even prevent early COVID-19 infection.
And that's it on the program. Don't forget to continue to take responsibility. You can visit our website. It's channelstv.com. You find the latest breaking news and several updates on the coronavirus. Our top story is there about US's donations on vaccines. Thank you for watching. I'm Millicent Wonwoka. Stay safe.